Medical technology, defined as the use of knowledge and understanding with procedures, systems, devices, and medicines to resolve issues relating to health in order to advance human life conditions, is advancing around the globe and becoming the driving force for curing the next generation. Indeed, advancements in medical technology have been adopted by countries and governments across the globe. Bangladesh and the United States, two countries that differ in terms of national development, have made advancements in technology, laws and regulations, as well as finance. However, due partially to these differences and a multitude of challenges, countries like Bangladesh have yet to progress at an equal pace to developed and resource-rich countries, as poverty remains a major issue. Further external issues relating to population increases detracts from the need to improve the health sector and its impacts on citizens. Current understandings in this field consist of the use of theoretical approaches to effectively narrow the gap, using the findings from technological advancement markers to point out disparities, as well as closely observing the effect of the social determinants upon their respective outcomes. Facing insurmountable challenges in social and structural contexts ultimately affects how these nations can address challenges within their medical systems. From rapid population growth to public distrust in the national health system, governmental projects may face many obstacles. As countries like Bangladesh continue to avoid healthcare progress due to external issues, industrialized countries like the United States remain unhindered. Welcome to Heart Overhead, a mini-documentary diving deep into the improper access to adequate healthcare in Bangladesh. Health inequality, as defined by the NCBI, is described as the differences in the health of individuals or groups. Any measurable aspect of health that varies across individuals or according to socially relevant groupings. A health inequity is described as a specific type of health inequality that denotes an unjust difference in health, when health differences are preventable and unnecessary, allowing them to persist is unjust. In other words, inequities are ways to avoid systematic differences through viable manners. Millions of people could be given effective care if only developing nations were given the same opportunities as the developed nations. Throughout the globe, the end to this void of inequality and inequity have always been thought about by governments, theorists, researchers, public health practitioners, as well as policymakers. When regarding these health inequalities, it is vital to understand the concepts of relative versus absolute. Health inequalities have been an historical issue spanning 50 years back, affecting how people conducted their lives and even how long they lived. When drafting the reasons for health issues regarding inequalities, differences in wealth and finance must be included. Since the higher paid will be able to cover medical fees, it results in the supply of better healthcare, one that the poor will be unable to receive due to the lack of affordability in optimal service. Bangladesh is a poor and densely populated South Asian country beside India and Nepal. Dhaka City, the capital of Bangladesh, is on the top 5 list of the most densely populated cities in the world. Economists predict that the overall population of the country is set to increase substantially from 164.69 million in 2020 to around 218 million in 2030. While the growing numbers of inhabitants is important to note, Bangladesh's ongoing changes and projects in sectors other than health are one to consider. This, in turn, directly corresponds to the dynamic inequality gap between other developed nations and Bangladesh's social and economic sectors. Bangladesh's high rate of urbanization adds an additional complexity to the disparities that exist as more of the population will be underserved. For example, the rural population outside of the cities migrating for better jobs and finance results in the lack of attention to these newcomers due to the rapid increase in population of the densely populated city. Not only does the Bangladeshi government tackle this, but also the health and safety of citizens is a cause for concern. Bangladesh's three-tier healthcare system, public hospitals, district hospitals, and medical college hospitals, calls for an effective and organized structure that has viability and effective methodology to treat patients. However, the technology in which these hospitals utilize limits the progress that they can make and the care that they can give. So, I'm at an information desk. However, there is nobody here. I'm at United Hospital, one of the biggest hospitals in Bangladesh. And yet, at an information desk where people seek information, there's nobody here. Public hospitals provide the primary tier of healthcare to all, regardless of class. They provide basic, necessary services and treat patients for free. However, patients often bear the cost of prescription drugs and laboratory testing, burdened with hidden fees, presenting a major issue. District hospitals are seen as secondary service centers, equipped with fewer tools and technologies compared to public hospitals due to treatment being offered at limited facilities. Lastly, medical college hospitals provide tertiary care. Yet, even these hospitals lack resources. Medical college hospitals have an increasing shortage of healthcare specialists and are limited in the type and quantity of diagnostic and laboratory services that they can provide. Not just evident in medical hospitals, but the entire health system lacks in appropriately trained human resources of health to start with. So all of these are working doctors. However, you can see that there is a lack of demand for this much supply, even though healthcare is heavily subsidized in Bangladesh. Wow, so many doctors, but not enough patients. Even they hold a lot of technologies like the MRI scan back there, the CT scans, and whatnot. However, there's just not enough patients and not enough people who are able to afford such technologies and informatics. আপনার নাম কি? রাবিয়া। আপনি কোন থেকে? নেত্রকোনা। আচ্ছা। আপনার কি কোনো ছেলে মেয়ে আছে? আছে। বাংলাদেশের চিকিৎসা আপনি কি মনে করেন? কি ভালো নাকি খারাপ? আপনি কি মনে করেন? বাংলাদেশে মনোরঞ্জন যে টাকা অনেক টাকা লাগে চিকিৎসা করতে, কিন্তু আমরা গরিব মানুষ চিকিৎসা করতে পারি না টাকা দিয়ে। এটা কি সহজ এই চিকিৎসাটা পাওয়ানো? না, এত সহজ না। আচ্ছা। চিকিৎসা করার পর আপনার আর কি সমস্যা এখানে পড়ে আছে? মানে আপনি কি কোনো কিছু কিনতে পারেন বা আর কোনো সমস্যা থাকে? না, আমাদের তো গরিব মানুষ টাকা পয়সা নাই, আর ধরনীয় টাকা পয়সা বলতে গেলে চিকিৎসা ভালো মতো হয় না। তো আর কি জিনিস আপনার দেখতে হবে? গরিব মানুষের তো অনেক সমস্যা, ওনার খাওয়া দাওয়ার সমস্যা, ঘর বাড়ি নাই, জায়গা নাই। এই আপনি কি চিকিৎসার জন্য কি ভয় লেগে যায় যে বেশি টাকা উঠে বা? হ্যাঁ, এটা তো ভয় লাগে যে চিকিৎসা করতে গেলে কত টাকা হয়, এই টাকার জন্য তো চিকিৎসা করতে পারি না। আমার জামাই অসুস্থ অলরেডি। বাংলাদেশের চিকিৎসা যদি আপনি পরিবর্তন করতে চান, তাহলে কি পরিবর্তনটা করতে চান? আমি মনে করি যদি একটু সহযোগিতা হয়, যে আমরা টাকা পয়সা দিক দিয়ে কম যাই, তেল আমরা ভালোভাবে চিকিৎসা করতে পারি। The gap greatly compromises those in need in Bangladesh regarding principle and practice in health facilities. Healthcare facilities in Bangladesh all face consistent issues related to the lack of medicinal supplies, available drugs, and family planning commodities. Public and private health sectors in Bangladesh play in effect with gaps due to technological advancements. Private healthcare facilities such as Apollo Hospital and United Hospital Limited both provide better healthcare than public hospitals. As shown in a study of hospitality and healthcare comparing the differences between top healthcare providers and lower class providers, advocates of private healthcare facilities have noted that these hospitals exhibit significantly smaller wait times and serve as main providers in optimal healthcare. In addition, private sectors have shown to have costly drug prices, hence resulting in the respective valuable treatment. This is where the inequality becomes evident, where the rich in Bangladesh tend to benefit while those of lower socioeconomic status tend to suffer at higher rates. Ambulances that have been given to the Upazila health complexes, the first referral health facility at the primary level of healthcare in Bangladesh, are misunderstood and misused for their proper intent 65% of the time. Lack of progression within the health sector in Bangladesh leads to the suffering of millions of people. Considering 3.4% of GDP in Bangladesh is spent on medicine, the technology in which Bangladesh is used to treat patients are years behind current advancement in this area when looking at developed countries. A prime example is the use of e-health, an emerging field in the intersection of medical informatics, public health, and business, referring to health services and information delivered or enhanced through the internet and related technologies.
আপনার নাম কি? আর আপনি কোন দেশে থেকে?
আমার নাম শেখ শহীদুল ইসলাম। আমি পিসপুর বরিশাল থেকে।
আচ্ছা, আপনার কি কোনো ছেলে মেয়ে আছে?
আচ্ছা, ছেলে আছে চারটে, একটা মেয়ে আছে।
যে টাকা বেতন পান ওই টাকা কি চলে নাকি?
ওই টাকা চলে।
পরিবারে যখন অসুস্থ হন তখন কি চিকিৎসা করতে কি বেশি টাকা লাগে? কষ্ট হয় আপনার?
অনেক কষ্ট হয়, এটি হয় না তো। বেশা কিনা করে তারপর কষ্ট হয়।
আচ্ছা,
আমার পরিবার অনেক বড়, বুঝছেন? সেই কারণে আমার যে পরিবার যদি কোনো অসুস্থ হয় এটাকে হয় না, বুঝছেন? তারপর জন্য বাড়িতে ডিগ্রি করে তারপর চিকিৎসা করতে হয়।
আপনি কি ভালো চিকিৎসা চান নাকি কম টাকার মধ্যে একটা চিকিৎসা?
আমি কম টাকার ভিতরে ভালো চিকিৎসা চাই।
আচ্ছা,
আমার যখন অসুস্থ হয় তখন বাংলাদেশ যে হসপিটাল যাইতে খুব ভয় লাগে। ওখানে ঠিক মতো চিকিৎসা পাওয়া যায় কিনা তাও বলতে পারতেছি না, এই কারণে যাইতে পারতেছি না ওখানে। বাংলাদেশের যে হসপিটালটা আরও উন্নতি যে ভালো, সেই জন্য আমরা ওখানে যাইতে চাইছি, কিন্তু আমাদের চিকিৎসা তেমন ভালো হয় না। সেখানে সুচিকিৎসার জন্য আমরা ভালো পাইতে এই ব্যবস্থা করি।
Although strides in e-health have been made in Bangladesh, the accessibility of e-health has been ignored since the elder Bangladeshis have been blind to the new technology, leading to gaps in patient education. Formal adoption of medical knowledge can present its own challenge in Bangladesh due to the education of the citizens, therefore leading to complications regarding whether patients are able to use electronic devices in the English language. For example, to accurately use electronic devices, one would need to have the skill to use mobile applications, search engines, browsers, and be able to use the internet. They would also have to be proficient enough with the English and Roman letters to understand their actions. Studies in Mirzapur, a town within the Mirzapur Upazila district of Tangal, Bangladesh, revealed that several participants have a lack of internet availability in electronic devices. This means that these citizens cannot access recent technological improvements to health services. Those in the town of Mirzapur prefer to avoid digital technology health initiatives as much as possible because they do not understand and trust digital technology, which alienates them. Bangladesh's political instability further damages the nation's progress as violence and unrest erupts. As the population increases further, these issues are only said to be exacerbated with the Bangladesh's poorly managed facilities and poor access to and utilization of health technology, furthering the need to remedy the major health crisis in Bangladesh.
আপনার নাম কি? আপনার দেশ কই?
আমার নাম ডালিয়া, দেশের বাড়ি কিশোরগঞ্জ।
আপনার কয় ছেলে কয় মেয়ে?
আমার নাম 6 ছেলে 3 মেয়ে।
আপনার পেশা কি?
মানুষের বাড়িতে কাম করি।
যে টাকা পাও ওই টাকা দিয়ে কি আপনার সংসার চলে?
না, এই কি হারে কিছু সংসার চলবো, দিন সব কিছু দাম টাম বাইরে গেছে কেন? এই টাকাতে তো কাম করলো কি চলে না, আর বাচ্চা কাচ্চারা কি চিকিৎসা করে নেই, এমনি দিন যান। এনে তো কি চিকিৎসা করবো, টাকা পয়সা যাওয়া কষ্ট করে দল করে দেই চিকিৎসা করবে লাগে, কিন্তু ভালো চিকিৎসা আর হয় না, কপাল মন্দ হইলে যা হয়।
বাংলাদেশের হসপিটালের মধ্যে আপনি কি চান?
আমরা গরিব মানুষ, কম দামে যদি চিকিৎসা ভালো মন্দ হয় তাহলে এই দিতেছে, আর কি আর চাই।
Financial, technological, and governmental challenges all account for the digression of overall national achievements. The disparity is exacerbated due to the difference in pace between developed and developing countries. Specifically, the access to technology differs too, the driving force for national advancement. Recent efforts and initiatives led by the government have allowed for the current state of medicine to be decent, but not at its full potential. With the development of e-health, a stepping stone has been achieved, but the majority of the population has not begun to access this technology, hence preferring to visit physical doctors for aid. Even here lies a disparity. To visit a valid and reliable doctor for aid is difficult due to the lack of resources primary health clinics have, the destruction of ambulances, improper treatment, and more leads to this factor. The question of payment and budget further hinders the ability of locals to get treatment in the first place. Because the majority of Bangladesh's population depends on the garment industry, which pays extremely low wages, the population lacks the ability to pay for adequate treatment. Perhaps looking into the steps taken by developed countries worldwide should be taken into consideration when finding effective solutions. However, currently, the question at hand has no clear answer in the solution to close the ongoing inequality gap as it keeps widening with the innovations of today. Not just in the context of Bangladesh, but the concept of disparities lie across the globe. At the end of the day, it is our duty and responsibility to advance humanity forward as the next generation of changemakers, and we must place our heads over our hearts in order to do so.